Not many people have been through extensive, psychological treatment prior to seeing me, and so they're not always real sure what to expect. What I want to do is be able to understand the patient's perspective in terms of what life has been like, and because that can look very different from just their set of symptoms. I want to be able to get a sense of what are they struggling with. How is their identity changing as a result of their health status? Instead of focusing on all the things that they can't control, my goal is to focus on all the things that you can in order to kind of be able to enhance their life. So if we can start from there during that first session, we can usually make some pretty good progress. I typically, want to provide a set of skills to patients in terms of how are they able to cope with some of the stress that comes along with their medical issues, and then be able to allow them to grow into those mechanisms so that they can use them on their own. Sometimes people will say, gosh, how do you do this all day? How do you, listen to people's stories, and some of what they go through is so sad and so tragic, and it's true. But at the same time, you also get to see the victory of the human spirit. It's that people are able to come through difficulties. They're able to display resilience, which is such an incredible thing to see. And so sometimes I feel lucky. I find it to be a privilege to work with people when they're in, the low spots of their life, and then be able to celebrate them when they come out on the other side.